Thank you. We have 2 items on the consent calendar. One is the approval of the meeting minutes of August 14th, sorry, and also the statistical data report. Is there any member of the CCP that would like to pull either of these items off consent? Is there any member of the public that would like to pull either of these items off consent? Do I have a motion to approve? Second, Elliot. Any further discussion, comments? All those in favor say aye. Aye. Opposed? Abstain? Thank you. Moving on to our scheduled items. We have the quarterly physical update on AB 109 funding and budget, and I'll ask Finance Manager Don Sosa to approach and present this matter.
Afternoon, Chair and CCP members. What you have in front of you is the staff report for the quarterly update. There have been significant changes in 3 areas that are noted in the staff report, including fund balance, revenue projections for the current year, revenue projections for future fiscal years. I'm going to address the fund balance changes first. Actuals are now reflected for fiscal year 2016-17. Expenditures were lower than budgeted, arriving at $9.8 million, which contributed to the year-end fund balance of $8 million, which plus the reserve of $1.8 million resulted in a total year-end fund balance of $9.9 million. Additionally, the current fiscal year 2017-18 was updated. The total fund balance at fiscal year-end is projected at $9.8 million, which includes the annual reserve of $2 million and a projected year-end fund balance of $7.8 million. Moving on to revenue projections for the current fiscal year. The current year revenue projections have been updated to reflect the actual growth allocation received by the county in late September of a net $681,000, and the projected main allocation, also known as the base, as shared in late September by the California State Association of Counties, is now $12.5 million. Moving on to revenue projections in future fiscal years. From fiscal year 18 and 19 and on, projections have been updated to reflect a rolling base, which is the same methodology used by the state when determining the target revenue for AB 109 programs at the state level. This methodology sums the prior year's base allocation and growth allocation to arrive at the new base target for the following year. So the state is using this same methodology when determining counties' allocations for ongoing years. Also updated is the amount of revenue projected each year, which now reflects an increase each year, which is equal to the same average percentage as forecasted by the state's Legislative Analyst's Office for the long-term forecast of sales and use tax revenues. Sales and use tax revenues are the main source of revenue for AB 109. There's also a smaller contribution by VLF, but it's for the purposes of projecting, it's really not material. The LAO's forecast is published yearly in the governor's budget and also on the LAO's website. The most recent LAO projection for sales and use tax this current year and the next 3 is forecasted at 2.1% average annual increase over these next years, and that's what's included in your projections. So if anybody has any questions, I'm available.
Are there any questions or comments from the CCP? Thank you, Don.
You're welcome.
Is there any public comment on this item? All right, seeing none, I'll bring it back to the CCP. Do I have a motion to, oh, no action is required, I'm sorry. All right, we'll just consider it received. Thank you. We'll move on to our scheduled matter B. Approve the additional budget augmentation requested by the Sheriff's Office, and I'll ask Under Sheriff John Minot to present that.
Thank you, Chair and Executive Committee members. John Minot, Undersheriff. Here today, we have a report put together, and it's a request for just under $1.1 million in additional funding this year. It's actually $1,081,378 to help with inmate health care. As all of you know, that since AB 109, we've seen a dramatic change in both the type of inmate and the type of healthcare issues we're seeing in local corrections. This graph that we have will just give a sense. This is in the AB 109 era. You can see what our healthcare costs have done in the county jail. Gone from just barely over $5 million back in 2011-12, and we all know that we went operative with AB 109 in October of 11. So from that fiscal year forward, we've seen an 89.5% increase in our healthcare costs in the county jail. During that same time, we've seen a lot greater demands on both the acute care patients and just the overall health delivery system. In Monterey County, what we saw from AB 109 was compounded with some of the litigation that we faced. And so between what we've seen with the AB 109 inmates and their health care needs, this is another chart that just gives you an idea on what we've seen with hospitalizations. This goes back all the way to 2010. But just to give you an idea, you know, we've seen a flat tripling in the number of hospital admissions, and then also with the hospital trips. So the blue bar is the number of folks that actually went to the emergency room, and then the orange bar is the folks that were actually admitted and had to stay in the hospital. So 2017 is year to date. That was as of about midway through October. So we still have, at that time, we had about 10 weeks left. So this is just to give you a sense of what we have seen with the healthcare system in the county jail. During this same time frame, we've had to dramatically ramp up the healthcare delivery to the inmates from the registered nurses. Obviously, this body has approved some of the positions that we have that support the inmate healthcare, the intake nurses, some of the deputies that we put on staff, just to work with our healthcare professionals to escort them in and out to help with medication deliveries and all the things to meet that inmate need. So as we rolled into this fiscal year, there's a couple of things that have come together. One, we're trying to renegotiate a healthcare contract that accounts, that really captures and formalizes where we are today with inmate healthcare moving forward, that continues to add the bodies. Our contract health provider has had to add 85% more people to their staff, and that's at all levels, from records to nurses, LVNs to RNs to psychiatric specialists to help with this population. So as that number has gone up, obviously the healthcare costs have gone with them. So this year, as we stand today, we are expecting somewhere in the neighborhood of a $1.1 million cost increase. That was how we came up with the 1.086 number that we asked the CCP to help us with. We're fighting this battle on two fronts this year, though, because we expect a $1.1 million increase in the contract. At the same time, in the governor's May revise, there was about a $6 million takeaway in public health realignment funds straight to Monterey County. And of that public health realignment, about $3 million of that was going to health, about $3 million of that was going to the county jail, specifically for inmate health care. So in total, we're fighting against about a $4.1 million hole in support of inmate health care this year. So because we had a good hard target with what we expect our contract to do, we expect it to go up by about 1.1. That was how we identified that number, to ask the CCP for really what amounts to help this year to try and get us over the hump. And in talks with the budget office, with Paul Lewis, I fully expect that if the CCP, if the committee approves the request, I expect that we'll apply that to the revenue side as opposed to the expenditure side. But that 1.1, every piece of that would go to support inmate health care this fiscal year. So with that, I'd be happy to take any questions.
There are questions, comments from the CCP? Chris? Yes. It's
It is a one-time request.
augmentation.
We're going to have a lot of work to do moving ahead to figure out how we're going to work within what, really, this is the definition. This is the modern-day county jail and how we're going to meet the healthcare need going ahead. But we're working as we speak to come up with some alternative strategies next year, but the options are limited as we're here today.
I had basically the same question, although I guess a corollary is, it sounds like you're assuming this is going to be an ongoing expense and likely will continue to increase based on the charts you showed before. So I guess the implicit question is this something that you might see yourself coming back to CCP again in the future?
I can certainly expect that as we work into the next year's budget workshop and adoption and allocation and request for CCP funds, we may have to totally scramble the way that we're asking for CCP funds to make sure that we can adequately meet the healthcare needs of this population.
Thank you. And the reason I ask is because of really the extent to which this expense might be considered to be incorporated into projected expenditures for CCP. Because it's an anticipatable cost. You know, I don't see anything happening in the larger landscape that's going to sort of cause these expenses to decrease going forward.
Well, and what we're hopeful is that we can, that there's a chance we can realign. Over the years, we've been able to realign. So we started out with pretty heavy contract expenses to other counties to house inmates. As our population's gone down, we've been able to redirect that. So we want to make sure we take a hard look at all of those, the way those monies are allocated this year and see if there's any way to reallocate those so we're not, but there's no doubt this is going to be an ongoing burden on the county.
Okay, thank you.
Any other comments from the CCP? Questions?
If this improves the medical care of the inmates in the county, then I support it. Thanks for bringing this to us.
Any other comments? Okay.
And I want to thank Chief Parsons for your support and your guidance on this and for spearheading this and identifying this, and your staff. It's greatly appreciated. It is a struggle for us, and it's going to continue to be a challenge for the Sheriff's Office, but thank you.
Thank you. Anything further from the CCP? I'll put it out to the public for public comment on this item. Seeing none, I'll take a motion. Any further discussion or comments? Okay, we'll call for a vote. Oh, I'm sorry. I'm sorry. I'll need another second.
I'll second.
Thank you, Chief. Thank you, Trish. Call for vote. All those in favor say aye. Aye.
Aye.
Oppose? Abstain? One abstention. Thank you.
Thank you.
Moving on to the 2017-2018 Community Corrections Partnership Survey, which is due to be submitted to the Board of State and Community Corrections by December 15th. This is an action item. I'll ask Adult Division Director Nancy Hatton to give the presentation.
Good afternoon, board members. As Chief Parsons said, this is due December 15th, so this is a completed draft version so that I still have time to make any changes or answer any questions, and we can get it submitted in time. This is a requirement that we have in order to receive the $150,000. That money is based on the size of our population, and for our county, we receive $150,000, but the requirement is that we submit this survey every year. We submit this survey, and BSCC uses this information to do their annual report on community correction partnership plans to the governor and the legislature every year. The survey is virtually unchanged from last year. I would just add that we highlighted some of our goals, like our success in housing access and our access to behavioral health contracted service increases. But our goals are ongoing, and we just do updates on them. So with that said, does anyone have any questions or comments on the draft version?
Any questions, comments from the CCP? Any questions or comments from the public? Thank you, Nancy. So I will entertain a motion to approve, so we can move this on to the state. Second? Okay, thank you. Any further discussion or comments? All those in favor say aye. Aye. Opposed? Abstain? Thank you. And our last item on the agenda is an approval of the meeting schedule for 2018. You'll see that we have 2 meetings scheduled in February. That's in order to deal with budget issues, should it become necessary to do that. If it does not become necessary, we will cancel one of those February meetings. Is there any comment or questions from CCP on the meeting schedule for 2018? Public? Any public comment? All right, I'll entertain a motion.
So moved.
Thank you, Chris. Second? Sheriff, second. All those in favor say aye.
Aye.
Opposed? Abstain? Thank you. Before I adjourn the meeting, I would like to propose or move that the December 11th scheduled meeting for this year be canceled. We scheduled that meeting in anticipation that perhaps the BSCC survey would not be finished in time, but there is no need for that meeting at this time that I can see. So with a motion to cancel, I'll take that motion. What? Who made the motion? Okay. All those in favor say aye. Opposed? Abstained? The meeting of December 11th is hereby canceled. And this meeting is adjourned. Thank you very much.